Terry and I decided to discuss HICS codes. Within the presentation, we will be discussing the purpose of HICS codes, the structure of HICS codes, examples of how HICS codes are used within each level, how HICS codes are updated and revised, the benefits of HICS, different challenges and limitations, and the relationship between HICS codes and ICD codes. The purpose of HICS is to establish a consistent way for categorizing and invoicing healthcare services, procedures, and supplies. It has 3 levels: level 1, which is CPT codes, level 2, which is CMS codes, and level 3, which are local codes. This code set improves communication among healthcare stakeholders, assures correct invoicing, and simplifies reimbursement procedures. For the structure, HICS is made up of alphanumeric codes that follow a defined syntax. They are composed of 3 layers, each with its own unique structure. Level 1 includes CPT codes, which are managed by the American Medical Association. CPT codes are numeric and they are 5-digit codes. They generally reflect medical treatments and procedures rendered by physicians and other healthcare professionals in clinical settings. Level 2 codes are alphanumeric and are managed by the Centers for Medicare and Medicaid Services. These codes cover a larger variety of healthcare services and supplies not covered by CPT codes. Level 2 codes can comprise both letters and digits and are commonly used for products such as durable medical equipment, ambulance services, and some pharmaceuticals. Level 3 codes, often known as local codes or temporary codes, are used for specific temporary reasons, including monitoring new technology, procedures, and services. These codes are not as extensively used as Level 1 and Level 2 codes, and they are limited to certain locations or payers. They are usually alphabetic and can vary in form depending on their function and use. Local medical organizations or insurers frequently generate these codes to satisfy special needs that Level 1 or Level 2 do not cover. For examples, an example of Level 1 is code 99213, a CPT code for mid-level office visit delivered by a physician or other competent healthcare practitioner. It includes assessment and management services such as diagnosing a patient's health, discussing treatment choices, and administering essential care during an office visit. An example of Level 2 is code E0601, and it identifies a continuous positive airway pressure device, a typical therapy for sleep apnea. It contains the CPAP machine and therapy-related consumables such as masks and tubing. An example of Level 3 is code S4081, and it may be used by a local healthcare provider or payer to designate a medical treatment or service that is exclusive to their location or organization. For example, it might refer to a particular diagnostic test or treatment plan that is not covered by Level 1 or Level 2 codes. Updates and revisions. HICS codes are updated and revised annually or quarterly depending on the level of the code. Level 1 codes are maintained by the AMA and they are updated and revised annually. For Level 2 and Level 3, they are managed by the CMS and they are updated and revised quarterly throughout the year. Level 2 codes are updated based on stakeholder recommendations, CMS review, public discussion, and finalization. Local Medicare contractors maintain Level 3 codes, which are often updated using a similar approach at the local level. It is important to stay updated on current HICS, including annual updates and revisions, because failure to follow these changes could result in incorrect coding or billing of a claim, which could lead to denials.
Benefits of HICS include the standardization of coding for improved communication and accuracy. Before procedure codes were created, written descriptions of surgeries performed could have been submitted up to 100 different ways. Another benefit of this is the facilitation of billing and reimbursement processes, as having revenue attached to each HICS gives facilities a good idea of how much reimbursement to expect. Support for research analysis and decision-making in healthcare is also made easier with the HICS code set, since reports can be run to show which codes are used the most in different facilities, and it can make it easier to locate these records in order to use them for research for future cases. Some of the challenges and limitations include the complexity of the coding system, meaning there's a lot of information there to remember and search through. HICPICS contains a total of 11,636 codes, with codes regularly being added and revised every year. This year alone had 345 new codes added. This can make it difficult to keep track of changes in the codes and could cause potential for coding errors. Interpretation of the codes is also sometimes a challenge to HICPICS coding, since the terminology used by providers does not always exactly match that of the code description. Some of the relationships with other classifications and terminologies include that of with ICD-10, which requires accurate combinations of HICPICS based on the test performed for certain ICD-10 diagnoses. The correct ICD-10 diagnoses codes can positively or negatively affect the HICPICS code selection, depending on if it's specified as much as possible by the documenting provider or not. A good example of this is when a provider documents a laceration repair but does not document the length of the laceration, location of the laceration, or the method of the repair. The correct HICPICS code cannot be selected for this scenario without obtaining additional documentation. Thank you for listening to our presentation. We hope you enjoyed it.